Welcome to today's video about dangers of avocado. Could something as nutritious and beloved as an avocado actually be bad for your health? What if I told you that this superfood could pose serious risks for some of you watching right now? Yes, you heard that right. While avocados are packed with healthy fats, vitamins, and antioxidants, there are certain health conditions that might make you want to think twice before reaching for that guacamole. Today, we're diving deep into the surprising truth about avocados. From severe allergies to complex interactions with medications, the impacts are more extensive than you might expect. Stay with us as we unpack the top health problems that should make you reconsider adding avocados to your diet. Are you at risk? Let's find out together. Just a quick reminder, the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice. Please note, every piece of information here has been authenticated by a cadre of professional researchers. Now, let's dive into the list of health conditions that might make you reconsider eating avocados, starting with number 1, migraine sensitivities. Avocado is one of the natural foods known to contain relatively high levels of tyramine, a naturally occurring compound that has been linked to migraine headaches in sensitive individuals. According to research, including a study published in the journal Neuropsychiatrie Ars in 2018, tyramine can trigger migraines by influencing serotonin levels and causing blood vessels to constrict and then expand. Those with migraine sensitivities might experience more frequent or severe episodes after consuming foods high in tyramine such as avocados, aged cheeses, and processed meats. The presence of histamine in avocados also adds to the risk. Histamine can induce migraines by promoting inflammation and affecting blood vessel dilation. A 2023 review in the Journal of Clinical Medicine discusses the role of dietary histamine in migraine development, suggesting that individuals prone to migraines may benefit from moderating their intake of high histamine foods like avocados. Understanding one's triggers is crucial, as migraine sensitivities vary widely among individuals. Keeping a food diary and monitoring symptoms in relation to diet can help determine if avocados specifically exacerbate migraines. For those who identify avocados as a trigger, limiting consumption may help manage the frequency and intensity of migraine episodes. Next, number 2, gallbladder issues. If you have gallbladder issues, such as gallstones or cholecystitis, it's generally advisable to monitor your intake of fatty foods, including avocados. This recommendation stems from the fact that high-fat foods can trigger the gallbladder to release bile, which is necessary for fat digestion. In the presence of gallbladder dysfunction, this can lead to increased symptoms like pain, nausea, and vomiting. While avocados are celebrated for their healthy fats, these fats still require bile for digestion, potentially exacerbating symptoms in individuals with gallbladder conditions. A study published in the Cochrane Database of Systematic Reviews in 2017 explored dietary recommendations for individuals with gallbladder-related disorders and emphasized the importance of a low-fat diet to prevent symptomatic episodes. This research supports the idea that even healthy fats, such as those found in avocados, might need to be consumed cautiously by individuals with gallbladder issues to avoid discomfort and complications. Therefore, if you have gallbladder problems, it's crucial to tailor your diet according to how your body reacts to different types of fats, and consulting with a healthcare provider for personalized advice is always recommended. Next, number 3, pancreatitis. Individuals with pancreatitis often need to follow a diet that limits high-fat foods to prevent exacerbating their condition. Avocados, despite their healthy fat content, are rich in fats that can be difficult for the pancreas to process, especially during episodes of inflammation or when the pancreas is impaired. This dietary consideration is particularly important because consuming fatty foods can lead to an increase in pancreatic enzymes, potentially causing pain and worsening inflammation in those with pancreatitis. A study published in the Nutrition in Clinical Practice in 2019 explored dietary impacts on pancreatitis and noted that diets high in fat could trigger acute episodes in susceptible individuals. The research underscores the necessity of managing fat intake in chronic pancreatitis patients to avoid exacerbating symptoms. This guidance aligns with general dietary recommendations for pancreatitis that advise limiting the consumption of fatty foods to manage and mitigate the risk of flare-ups effectively. Next, number 4, oral allergy syndrome. If you're dealing with oral allergy syndrome or OAS, it's advisable to be cautious with certain foods, including avocados. OAS triggers allergic reactions in the mouth and throat, typically manifesting as itching, tingling, or swelling of the lips, tongue, and throat shortly after consuming raw fruits or vegetables. This condition is related to cross-reactivity between pollen and food proteins. Avocados, in particular, are known to cross-react with latex fruit syndrome. This connection was highlighted in a study published in the Molecular Immunology in 2011, which detailed the cross-reactivity profiles of various foods, including avocados, in patients with latex allergy. The study underscores the risk avocados pose for individuals sensitive to this cross-reactivity, suggesting that those with OAS linked to latex might experience similar symptoms when consuming avocados. Therefore, if you have OAS, especially if it's related to latex allergy, avoiding avocados could prevent uncomfortable or potentially serious reactions. Next, number 5, sensitivity to salicylates. Individuals with sensitivity to salicylates may need to be cautious with their intake of avocados. Salicylates are naturally occurring chemicals found in many fruits, vegetables, and other plant foods, including avocados. They can trigger adverse reactions in people who are sensitive to these compounds. Symptoms of salicylate sensitivity can include headaches, skin rashes, asthma, and gastrointestinal issues. In the context of recent studies, a 2017 review published in the Journal of Food Composition and Analysis highlights the impact of dietary salicylates in susceptible individuals. This review suggests that dietary management, including the avoidance of high salicylate foods like avocados, can significantly alleviate symptoms in those with recognized sensitivities. The study emphasizes the importance of tailored dietary approaches to manage adverse reactions effectively. Given this information, if someone has been diagnosed with a salicylate sensitivity, it might be beneficial to limit or avoid avocados to see if symptoms improve. Next, number 6, oxalate sensitivity. For individuals with oxalate sensitivity, careful management of dietary oxalate intake is crucial because high levels can contribute to the formation of kidney stones and other health issues. Foods high in oxalates, such as spinach, beets, and almonds, are typically advised against in diets tailored for those with this condition. Avocados, containing moderate amounts of oxalates, might also need to be limited to avoid exacerbating symptoms or complicating kidney health. A study published in the Foods in 2023 examined the oxalate content of avocados and found that they contain varying levels depending on the part of the fruit and its ripeness. This variability suggests that while avocados are not the highest in oxalate content compared to other foods, they still pose a risk for those who must manage their intake closely. This information highlights the importance of being mindful of not just the well-known high oxalate foods, but also those like avocados, which might be overlooked. Those with oxalate sensitivity should discuss their diet with healthcare providers to tailor a plan that considers the nuances of oxalate content in different foods. Next, number 7, liver issues. Concerns about avocados and liver health primarily stem from the presence of certain natural compounds in the fruit, specifically estragole and anethole. These compounds have been shown in animal studies to have hepatotoxic effects when consumed in large quantities. For example, research published in the Evidence-Based Complementary and Alternative Medicine has indicated that these compounds, when isolated and concentrated, can induce liver damage in some types of animals such as mice and rats. However, it's important to note that these studies often involve much higher doses of the compounds than what would be typically consumed in a normal diet. For people with existing liver conditions, such as liver cirrhosis or hepatitis, the concern is that even normal dietary levels of these compounds might pose risks. The liver's compromised ability to process toxins could potentially exacerbate the effects of these compounds, leading to an increased risk of further liver damage. Therefore, those with liver issues might choose to limit or avoid consumption of avocados as a precautionary measure to minimize any potential negative impact on liver health. While direct human studies are limited, the potential risk highlighted in animal studies and the critical role of the liver in detoxification and metabolism suggest a cautious approach is warranted. As dietary habits and responses can vary greatly from person to person, consulting with a healthcare provider for personalized advice is always recommended. This approach ensures that decisions about diet are tailored to individual health needs and conditions. Next, number 8. FODMAP Sensitivity. For those with FODMAP sensitivity, managing symptoms often involves avoiding foods that are high in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These short-chain carbohydrates are poorly absorbed in the small intestine and can cause significant digestive distress in susceptible individuals. Avocados are considered a high FODMAP food because they contain excess amounts of sorbitol, a type of sugar alcohol that falls under the polyols category. Consumption of foods high in polyols like sorbitol can lead to symptoms such as bloating, gas, stomach pain, and altered bowel habits, which are common in conditions like irritable bowel syndrome or IBS. Supporting this, a 2016 study published in the Gastroenterologia I Hepatologia explores the impact of a low FODMAP diet in reducing IBS symptoms, highlighting the need for individuals with FODMAP sensitivity to limit foods like avocados to manage their condition effectively. This diet specifically reduces the intake of foods that are known to exacerbate symptoms, offering a clearer pathway for those affected to manage their digestive health through dietary adjustments. Next, number 9. Hypotension. People diagnosed with hypotension or low blood pressure should exercise caution when adding avocados to their diet due to the fruit's high potassium content. Potassium has the ability to further lower blood pressure, which might be beneficial for those with hypertension, but poses risks for individuals with already low levels. This nutrient helps regulate heart function and vascular tone, but in excessive amounts, it can lead to too much relaxation of blood vessels, exacerbating symptoms of hypotension such as dizziness, fainting, and weakness. A comprehensive review published in 2014 in the Advances in Nutrition highlighted the role of potassium in blood pressure management, emphasizing its impact on those with hypotension. The study indicated that while potassium is crucial for overall cardiovascular health, its intake needs to be carefully balanced in people with low blood pressure to prevent adverse effects. This underscores the importance of monitoring dietary potassium sources, including avocados, especially for individuals on medication for hypotension or those experiencing frequent symptoms related to their condition. Adjusting intake with professional guidance can help manage and stabilize blood pressure levels effectively. Next, number 10. Nutrient absorption issues. Nutrient absorption issues can be significantly impacted by the consumption of high-fat foods, including avocados. A diet that is overly rich in fats may hinder the absorption of certain minerals and water-soluble vitamins. Avocados, while nutrient-dense, contain substantial amounts of fat, which could exacerbate these absorption problems. Specifically, excessive fat intake can form complexes with calcium, magnesium, and other minerals, making them less available to the body. Additionally, the presence of large amounts of fat can slow gastric emptying, which affects the overall rate of nutrient uptake. A study highlighted in the Encyclopedia of Food in 2016 investigated the impact of dietary fat on nutrient bioavailability. It suggested that while certain fats can enhance the absorption of fat-soluble vitamins, they may also impede the efficiency of absorbing other essential nutrients, particularly in individuals with existing gastrointestinal conditions that affect digestion and absorption. This research points to the importance of moderating fat intake for those with nutrient absorption issues to prevent potential negative impacts on their overall nutritional status. Next, number 11. High fiber sensitivity. People sensitive to high-fiber diets might experience discomfort such as bloating, gas, and abdominal pain when consuming foods like avocados, which are rich in dietary fiber. In a detailed study published in 2020 in the Clinical and Translational Gastroenterology, Researchers found that while dietary fiber is broadly beneficial, some individuals have a lower tolerance threshold. These individuals can react negatively to the 6.7 grams of fiber found in a typical medium-sized avocado. This reaction is due to their digestive system's reduced ability to process large amounts of fiber efficiently. The study suggests that moderation or avoidance of high-fiber foods may be necessary for these individuals to maintain gastrointestinal comfort and function effectively. Next, number 12, blood thinner medication. Taking blood thinner medications, such as warfarin, requires careful management of your diet to maintain consistent vitamin K levels, since fluctuations can affect the efficacy and safety of the medication. Avocados are rich in vitamin K, a nutrient that plays a crucial role in blood clotting. Sudden increases in vitamin K intake can decrease the effectiveness of warfarin and similar anticoagulants, potentially leading to an increased risk of blood clots. A study highlighted in the Expert Opinion on Drug Safety in 2006 emphasized the need for patients on warfarin to maintain stable vitamin K intake to avoid compromising the therapeutic effects of the drug. This research underscores the importance of monitoring dietary choices that can significantly impact vitamin K levels, including the consumption of avocados. Given these considerations, it is advisable for patients on blood thinners to consult healthcare professionals about their diet, particularly about how much avocado is safe to consume. Next, number 13, chemical sensitivities. People with chemical sensitivities might find that avocados pose certain risks, particularly due to the use of pesticides and chemicals in their cultivation. A study published in 2016 in the Journal of Food Protection highlighted the presence of pesticide residues in avocados. Although avocados have a thick skin that generally protects the inner fruit from pesticide exposure, individuals who are particularly sensitive to chemicals might still react to trace amounts. Additionally, during the ripening process, avocados are often treated with ethylene gas, a practice that could potentially affect those with heightened chemical sensitivities. Given these factors, consuming organically grown avocados or thoroughly washing them before use is especially important for those with chemical sensitivities to minimize exposure to these substances. Next, number 14, medication interactions. Understanding the interaction between avocados and certain medications is crucial for managing health effectively. Specifically, avocados are rich in monounsaturated fats and can influence the absorption and efficacy of various medications. One of the critical interactions occurs with cholesterol-lowering drugs, such as statins. The high fat content in avocados can potentially increase the concentration of statins in the blood, intensifying their effects and side effects. This interaction is significant because it can lead to an increased risk of muscle pain, a common side effect of statins, which in severe cases could lead to rhabdomyolysis, a serious condition involving muscle breakdown. Research published in the Europe PMC in 2021 explored how dietary fats, including those from avocados, impact the pharmacokinetics of lipid-lowering drugs. The study highlighted that consuming high-fat meals when taking statins could alter the drug's absorption rates, potentially leading to either suboptimal therapeutic effects or an increased risk of adverse reactions. These findings underscore the importance of monitoring dietary intake and medication interactions closely. Patients on specific medication regimes should discuss their diet with their healthcare providers to ensure there are no adverse interactions with foods like avocados that could compromise their treatment efficacy or safety. Next, number 15, latex allergy. People who are allergic to latex might also react to avocados due to a phenomenon known as latex fruit syndrome. This condition arises because some of the proteins in latex that trigger allergic reactions are structurally similar to those found in various fruits, including avocados. This similarity can cause the immune system of someone with a latex allergy to mistakenly identify and react to these proteins in avocados. A notable study published in 2018 in the Journal of Allergy and Clinical Immunology, in practice, investigated this cross-reactivity and found that up to 50% of individuals with a latex allergy could experience allergic symptoms when consuming avocados and other related fruits. Symptoms can range from mild itching or hives to more severe reactions like anaphylaxis, emphasizing the need for caution among those with known latex allergies. And that's it for today's video. We hope you found our deep dive into the unexpected side effects of avocados both enlightening and helpful. If you liked what you saw and want to see more content like this, just drop a yes in the comments below. Your feedback really motivates us to keep producing informative and engaging videos. Don't forget to like, subscribe, and hit that notification bell so you never miss out on our latest videos. Thanks for watching, and stay healthy.